Yeah, exactly. When we're told we couldn't vote, like,
Ligia Montano, and I'm with Senior and Disability Action.
We're here around an issue of Proposition 1. Maybe you can talk about what your concerns are about that.
Yes, my concerns are that we are, in this proposition, I feel that this is to put people away without really addressing the needs. The needs are great. We need more mental health, and we need more affordable housing. We need really the long-term services and support that will keep people in their place and that will also have a quality life. And when you stash people away, that doesn't happen really. You need to let people be in community.
And the healthcare system in California is privatized pretty much. I mean, private companies. How does that affect the treatment of mentally ill?
Well, I think that the problem with privatization is that always decrease the quality of care. Privatization, what it does is that, is all focused on profit and not focused on the care. And so this is the same thing that is going to happen. It's going to be focused on, how much people are, these corporations will be making instead of what kind of care people will get. And so we are really concerned because, we work with seniors and people with disabilities, which are the more affected when it comes to this measure. So I would like to see that, we invest more and keep people at home.
And what would that require to do that?
Will, I think political will. It requires political will because California is one of the richest states, and what we haven't seen is the political will to really invest in what is needed. And it's always like a little bit of a, there's kind of like Band-Aid solution, in my opinion, because, privatizing doesn't mean that it's going to be better. In fact, most of the privatized issues are showing that it's the opposite of making it better, like what is happening in Medicare, for instance. There's all kind of things that have shown, from our experience that privatizing is not the solution.
I'm Bradley Wiedmeyer. I'm a IHSS home care worker in San Francisco County, and I'm very concerned about the direction of care in the city, and the drive to privatize in San Francisco is now being added to by Prop 1, which would privatize statewide and shut down a lot of some programs that are doing good. And every other week in San Francisco, we have another privatized agency being outed as running off with the money and not getting the job done. And these privatized managers pay themselves terrifically, and then they under substandard wages to the workers. And so it's a real crisis in San Francisco, and now apparently Governor Newsom wants to take it statewide. So
I'm here.
What's your name?
My name is Darren Phillips. I'm here for Swords to Plowshares to be a part of the SEIU Yes on One, and just to hear what they have to say. As a member of Swords, we come down neutral on the topics currently, but the more information will be supporting.
And a lot of the veterans have stressed out healthcare problems. What is the situation for veterans in San Francisco and the state of California?
Veterans in San Francisco and California as a whole are coming into the city looking for services and promises that were made, and we provide a guidance for them, an access point to the system, but it is a bureaucratic nightmare right now.
How many homeless veterans are there in San Francisco? There's any estimate?
I couldn't give you that estimate. I'm sorry. I don't know.
The issue of housing for veterans, is that an issue?
It is a challenge, the same as the individuals that are entering into Section 8 There's waiting lists for those types of governmental assistance. And
How long is the waiting list?
months, years, depending upon each situation, each individual's story is different, and each avenue is different.
So what happens when you don't get that Section 8?
There are other stop gaps, but they have time limits. The avenues for them, the supportive services, the rapid rehousing, the shallow subsidies, there's a myriad of benefits available, but it's being able to check that box. A lot of our homeless veterans that run end up having issues with their discharge status. That's where SWORDS comes in, because we don't, regardless of your discharge status, we're able to help, whereas the VA is now in the process of amending and changing their discharge status. So if you had a other than honorable or a less than honorable, you're denied services through the VA.
And a lot of, well, not a lot, but there are members of the military who get stressed out, have mental health care problems, and then are forced to leave, and then they end up in the streets. Is that a real?
That is true. That during the process of the military service, because of what the soldiers experience in the military, can cause them to have a breakdown and be considered unfit for duty, discharged with an other than honorable or less than honorable, dishonorable, and of that, they end up hitting the street because now they've had a blow to their mental health. And that is a stigma that they will carry, and a lot of times never come back to seek assistance through the government because they've been burned once.
And the issue of suicide, of highest rate of veterans, I mean, is that continuing?
We have the Fox grant that's supporting now, trying to address that, where the mental health side is. There's continual work, and because it is tracked so well, there's a flat line potentially, but it's an ongoing problem. We are taking people and putting them in high stress situations. We're taking these individuals and placing them don't have to go to combat to have PTSD. You can be, through the training process, broke down and reestablished. And in that vein, that can create the problems that will manifest later in life in PTSD.
In other countries, you have national health care, Canada, Japan, Europe. The whole healthcare situation in the United States, it seems like it's breaking down. People lose their jobs, they lose their health care. What's your view of the whole healthcare crisis in the United States? I mean, it affects veterans who need health care and have problems getting it.
I agree. And what I can tell you is that for the VA was targeted for a long time as being the worst one, terrible for veterans. They're making strides now in opening their arms to all veterans, people of mental health, and extending what we just talked about. The nationalized health care we have, in a manner of speaking, that no one will be turned away from a hospital, but there is an overwhelming, you have a perfect storm here in the city. I work in Tenderloin, and it is tough because you have new people coming in every day that are exacerbating the problem within the streets, within the shelters, within the organizations. But we also have more organizations here than any other place in the country to assist.
So that's one of the people have concerns. Billions of dollars apparently going, but it seems like the problem is not going away. There's a systemic problem.
If there's a steady, if you keep putting water into a bathtub, it's going to overflow. And people keep coming into the community here. It's not that the problem is growing, it's that this is a beacon for what is going on. And people, it takes a lot of money to support. The supportive services for one individual alone is expensive. And to have the infrastructure for the housing, for the medical, for their finances, for all the different aspects of it, it becomes challenging. And communities outside do not have the infrastructure set up. But it is overwhelming for this community, and it's tough.
Okay, thank you. Are you a doctor?
I am.
Can you talk about why you're here today?
Well, we are in a setting of an urgent mental health crisis, and I think that the governor is trying to do something innovative to help make it better for lots of people.
And the healthcare system seems to be breaking down. You have a lot of angry healthcare workers who've been on strike at many of the institutions. What's happening within healthcare?
Well, I mean, healthcare is a massive, it's a very big morass of complicated things, and it's very hard to deliver excellent healthcare to all of the folks, and people need to do so and also take care of themselves, and sometimes that's hard to do.
And a lot of healthcare is relying on your job. If you're not working, you lose your healthcare.
Yes.
Is that a concern that you have?
Of course. I mean, the way that we fund healthcare in this country is very, again, complicated, and I don't know that anyone knows the perfect answer, but it's clear that we need to provide healthcare to everyone who wants and needs it in our country.
And a lot of the institutions, the healthcare, are overloaded. You think that's going to change with this bill?
Well, my hope is that on the behavioral health side, that if we bring more focused resources to the folks who need it the most, then we can support them in a way that we haven't been able to do in the past. So,
there have been a lot of issues with California regulation, particularly mental health. Even like Kaiser has been fined millions of dollars for not providing appointments for people who have health insurance. What does that say about the system?
You know, I'm speaking for myself. My own personal view is that we don't have enough mental health providers for all the people who need mental health support. We know that of the youth in our country, more than 40% of them have diagnoses of mental health issues, and more
over
than
40% of the youth in this country have diagnosis of mental health.
That's right. And more than half of them don't get any support at all. So we need to find new and innovative ways to support all the folks who really need care.
Do you think national health care, public health care, would change that? It seems like now it's all privatized and you have private companies making it.
Yeah, you know, I think that there are lots of ways to deliver healthcare better than we do now, and that's one of the ways that's a potential. There's so many barriers to it in our country, ideologically and culturally. I don't know how we get there. I don't have all the answers, but I think that everyone deserves healthcare.
It's a human right?
Absolutely.
Where do you work?
I run a mental health startup for youth.
What's it called?
It's called Flourish Labs.
Flourish Labs?
Yeah.
What does that do?
We train youth to be certified peer supporters and broaden the mental health workforce, and then we deliver peer support for adolescents and young adults on a telehealth platform.
And a lot of young people are on the streets. Is that causing these mental health problems? Living on the street for young people?
Well, I mean, clearly living on the street isn't the way that people should live anywhere. So, yeah.
Okay, thank you.
Yeah, and can you tell me?
Hello.
What's your name?
Hi, I'm Rob Murphy from the Oakland Fire Department.
And what's going on here today?
We're here to support Gavin with Measure 1 because homelessness has been something that we've been directly affected with, and we see it day in and day out. It's become a huge part of our job, and we just want to see a humane and just end to it, hopefully, and that's going to require some funds behind it. So we're here to support him and support Measure 1.
And not having housing causes mental health. Is that a concern of yours?
Oh, absolutely, absolutely. I mean, we as both first responders and paramedics, it's something that we encounter on a day-to-day basis, and we see the struggles that people have that are living out on the streets every single day. So I 100% agree with that.
And, I mean, California is a rich state. Why are we having homeless here?
Yeah, that's $1 million question. If you could figure out the answer to that, you'd probably be in Gavin's seat. Yeah. I definitely don't know the answer to that, but I totally agree. It is absolutely ridiculous that we have people living in third world type living situations in the richest state, in the richest country in the world.
And I mean, mental health, I mean, a lot of crime, I mean, people are mentally ill. Does that figure into what's going on?
Absolutely, absolutely. I mean, obviously, I don't know necessarily how things are in San Francisco, but in Oakland we have a massive fentanyl crisis, and it's very hard for people to get treatment when they don't have a place to live. They don't have a permanent address, so it's very hard for them to get the resources they need, and it just becomes a never-ending cycle.
And public services, I mean, cities are facing cutbacks in services. There's a crisis, fiscal crisis. How does that affect firefighters?
It absolutely affects us because we're being asked to do more with less. And these unfortunate people that are living out on the streets require a lot of our resources because they are so reliant on social services. And we are the one social service that never says no. That we're always going to be there for you whenever you call, day or night, any day of the week, 365 days a year, 24 hours a day, we're there. So we end up being the catch-all for a lot of that when people fall through the cracks.
So you're doing some of the work which mental health care workers or mental health or a healthcare system should be doing.
Absolutely, and we don't necessarily have the training to do it. I mean, we're doing the best we can with the skills and abilities that we do have, but that's not necessarily what we specialize in. So it would be better if they were in a place where people that understood their needs, it could better serve them.
And this bill will provide funds for private companies, others to set up these services. Are you concerned about privatization?
I don't know.
We don't have a public health care system in California. You have private agencies.
Yeah, I don't know enough about that to comment on that one. Yeah.
Okay, thanks.
Yeah, thank you.
Okay. Are you supporting Proposition 1?
Yes, we are.
Okay.
Obviously, we support more housing. This is going to bring, I think they said 11,000 units, and we want to be the ones that build it.
I see. Are you concerned about homeless? I mean, there are a lot of homeless in San Francisco. Do you think private development is going to make it safer for people?
I think we need development at all levels. We need affordable housing, we need market rate housing, we need middle income housing. I think that's really the only thing that's going to solve the problem, and also putting people back to work.
Well, it seems like there are a lot of $1 million condos being built in San Francisco and the cities, but working people can't afford it, including your own members can't afford to live in San Francisco.
Are there $1 million units in San Francisco? Absolutely.
Many $1 million units, yeah. But your members and a lot of workers can't afford to live in San Francisco because of the cost of housing.
Right, a lot cannot afford it. That's why we need to build more housing.
Yeah, but do you think the developers are going to make sure that it's housing for working people? I mean, your members need housing. They have to commute. They live in Central Valley. I mean, it really is a serious concern.
Yeah, that's why I'm saying we need to build housing at all levels.
Do you think the developers are going to do that? Because it's been shown that they're mainly interested in $1 million condos for rich people, basically.
Well, we're supportive of affordable housing as well, right?
Is there any being built?
That's all that's being built right now is affordable housing in San Francisco, and that's all that's basically on the agenda moving forward.
Okay, thanks.
Thank you.
Mental illness. There are a lot of people who are being removed from the streets who are homeless. Doesn't that add to the mental crisis in San Francisco?
Right now, what we're trying to do is get them into shelter. And so when you allow them to languish on the street, oftentimes suffering from addiction, acting in ways that can often be erratic and dangerous to others, that is not safe for them and it's not safe for anyone else.